Okay, so Doctor, just now you mentioned about whiteboard markers and drawing. Maybe you can explain to us what you're talking about, drawing on the problematic spots and all that, yeah.
Okay, yes.
Yeah.
For this tummy you see over here, it's generally a very wide and diffuse distribution of fat. So you can sort of make out where the fat is, but you can't really see where exactly the fat starts and where the fat ends. And what do? We would draw the applicators with whiteboard markers. So we have a template. These templates are 3D. They mimic how applicator looks like in terms of shape, and we place it over the fatty bulge. An applicator is a part of the machine that actually sucks in the fat and the skin and does the physical cooling. And these applicators are placed on the tummy over a period of time. So for us to make sure that we have accurate placement, we do have to draw with the templates where we're going to put the applicators. So that's really the most important part of the treatment process, which is not treatment itself, but the planning and the preparation. And we are probably going to have one large applicator below like this for the bottom in this case, and then maybe 2 more over here with a little bit of overlap. And these might be a little bit smaller. Okay, so it's called the C150 applicator and the C240.
Okay. I mean, it's good that you showed me this because, I mean, just looking at this picture, all I can see is this fat bulge at the bottom. I don't really see that, okay, the person need 2 more over here.
Yeah, it's very important. So the first 2 eyes are very important. First 2 eyes, the doctor's eyes, make sure that there's appropriate placement of the applicator. So for example, let's say this person, this same person has a less diffuse pattern and it's a very localized pattern. Not in this case, but just imagine that this person has a diamond shape kind of fat pattern. Then we are likely to put 4 smaller applicators with crisscross a little bit like this in order to get the job done, because they only have it in the center and not so much on the sides. For men, we like to reduce this area of fat, a little bit lower down to get a V-shaped body. Whereas for women, we generally want to reduce the waist a little bit higher up here in order to get a more of an hourglass shape.